My name is Beau Kilmer, and I serve as the Macaulay Chair in Drug Policy Innovation and the Director of the Drug Policy Research Center at RAND. So when I was 20 years old, I had a summer internship with the RAND Drug Policy Research Center. And at the end of the summer, they asked me if I wanted to continue working remotely and that they would give me a computer. And look, at the time I was working multiple jobs on campus at Michigan State. So the idea of getting paid California wages to keep working on drug policy, I thought, I'm in. So as I continued with my undergrad as well as my master's and PhD, I was primarily doing work with researchers at RAND. And little did I know that those 3 months would turn into nearly 25 years of working at RAND. And today, I direct our Drug Policy Research Center, where we work on a variety of issues related to substance use and drug policy, ranging from prevention to treatment to harm reduction to trying to figure out the most appropriate roles for criminal justice agencies. And for me personally, I spend a lot of my time doing research on alternatives to cannabis prohibition, looking at new approaches to reducing alcohol-involved crime. And lately, I've been spending a lot of time focusing on reducing the harms associated with the emergence of illegally manufactured synthetic opioids like fentanyl. I think the most important thing we could do is really to start thinking outside the box. The nature and the magnitude of the problems we're having with illegally manufactured fentanyl make it more like a poisoning outbreak than a typical drug epidemic. So we can't treat it like a traditional drug problem. Now, of course, we could be doing a lot more in terms of increasing access to quality treatment. Increasing funding is necessary, but it's not sufficient. We need to be doing a better job of integrating substance use disorder treatment with mainstream healthcare. There are also a number of administrative and regulatory barriers. But one thing the federal government could do is support innovation at the state and local levels. For example, we could be piloting treatments for opioid use disorders that they're using in other countries, but not in the United States. I'd say I'm most proud of the work that my team has been doing on losing your license to drink. Right? I mean, essentially, when you turn 21 in the United States, you get a license to purchase and consume as much alcohol as you want. But the question I've always had is, what point should we suspend or revoke that license to drink? And so for the past 12 years, I've been doing research on 24/7 sobriety programs, which are focused on individuals who get caught repeatedly for threatening public health or public safety because of their alcohol consumption. And so 24/7 sobriety is a program for justice-involved individuals where they're ordered to abstain from alcohol, and then they're subject to frequent testing. Oftentimes it's twice a day, once in the morning and once at night. They'll come to the police station and blow into a breathalyzer. If there's any alcohol in their system, they'll go to jail for a night or two. So the idea is it's a swift, certain, but fair sanction. They're not revoking probation. They're not putting someone back in jail, for multiple months. But the idea is to hold people accountable. When I was 22 or 23 years old, I was doing research on drug policy. But I was spending most of my time in libraries or, and trying to figure out this whole internet research thing. I was pretty detached from what was really going on. And one of my mentors at the time, the late Martin Noguchi, he saw that. And he said, Beau, why don't you come down to the methadone clinic with me and talk to the patients? And that's what I did. I would talk to them about their experiences, their challenges, their successes. And those conversations really changed me. It took something that had largely been an academic exercise, and it really humanized the issue for me. When we would get to the clinic, there are some people who were, unsheltered, who were staying nearby, and they would just get up in the morning, they come by, get their methadone. There were other people that would pull into the clinic in their BMWs. And so that really, made it clear to me that, substance use disorders affect all aspects of society. But it also hit home, for me that, for some people, they need more than just treatment to be able to successfully address their substance use disorders. Some people need more services.